This is TTT Live. I am DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, and on Facebook at TTT Live Online. We go now to the Minister of Communications, Donna Cox.
Good morning and welcome to today's virtual media conference to apprise you of government's efforts to combat COVID-19. Today with me are the Minister of Health, the Honorable Terence Dial Singh, Dr. Hazel Othello, Director of Mental Health at the Ministry of Health, and Camille Campbell, Counseling Psychologist at the Northwest Regional Health Authority. The Minister of Health, the Honorable Terence Dial Singh, will provide an update on COVID-19 in Trinidad and Tobago.
Good morning and thank you, Minister Cox.
Good
Good morning to Dr. Hazel Othello and our new guest this morning, Mrs. Camille Campbell, Counseling Psychologist, who is here specifically this morning, and I hope we can pepper her with some questions to deal specifically with the issue of COVID, young children, and exam issues which will arise soon, because we have to take care now of that special population of our young children preparing for exams. So the global picture, globally, there's a accumulated total of 9,361,855 cases around the world. So at the rate that we are going, we'll be hitting the 10 million mark pretty soon. There are 480,647 deaths globally, and of the 9.3 million cases, 5,080,349 have in fact recovered. The number of daily new cases continues to be worrisomely high, in the vicinity of 150 to 175, sometimes even getting close to 200,000 cases per day. So the rate of acceleration continues. It has not slowed down. Where are we in Trinidad and Tobago as we play our part to flatten the curve in this global pandemic? Number of tests done to date, 4,385. Total number of unique patient tests, 3,828. Number of repeated tests, 557. Number of community tests as of 23rd of June, 1,760, of which 190 were conducted in Tobago, and thankfully all of those are negative. What is the clinical update across the parallel healthcare system? In Cora, initially we had 6 cases. You remember those 6 persons came from the cruise ship. We have had to transfer 1 person from one of the UV facilities for non-COVID related illness. So they are under the care of a doctor there, non-COVID related matter. So at Cora, we now have 7 persons totally isolated from the rest. Let me make that point clear. At Couva, there is no one there at all. Home of football, no one is there. At UWI, we have 50 persons, and hopefully the vast majority of them, that is at the UWI Penal DB campus. Hopefully the majority of them, once their tests come back negative, I will give you rough dates. They could be back home between the 29th of June to the 1st of July, assuming all goes well. At Chancellor, state supervised quarantine, we currently have 22 persons. Again, with the proviso, if all goes well, they could actually be going home between today and tomorrow, and maybe on Friday. So within this sort of 3-day period starting from today, Chancellor can be decanted if all goes well. At Tacarigua, we have no one there, thankfully. The last 29 persons were discharged on the 18th of June. At Napa, which is reserved solely for healthcare workers, we have 18. At the home of football, we have 8 persons. And again, according to how things go with their negative tests, they can be released from as early as today over the next couple of days once everything goes well. At the Sangre Grande Brooklyn Center, where we have 24 nationals from Venezuela. Hopefully, again, if all goes well, they could look to be returning home sometime in early July. The Enchantment of the Seas, where we currently have 295 persons. Their absolute quarantine period ends on, I believe, Saturday. So we are looking at that. As you know, we were not able to board the ship yesterday or bring persons out to be tested because yesterday was supposed to be a swabbing day. So right now, the Chief Medical Officer and Dr. Mariam Richards, who is in charge of the logistics of that operation, are having some discussions with officials at the port to see what contingency plans we can put in place. I am hoping that their discussions with port officials are fruitful, and if all goes well, we will swab those 295 nationals tomorrow. At the UWI Canada Hall, where we have our students from Mona, Jamaica, we currently have 99 persons there. Hopefully, again, if all goes well, around the 27th, 28th of this month, thereabouts, they can go home. Same thing with UWI Freedom Hall, where we have 46 students from Barbados. 29th July, 30th July, around there, once their tests come back negative. KPOC, where we have 48. We are looking at, again, all goes well, early July, 1st, 2nd, around there. And that's where we are now. So it's a massive undertaking, as you can see. I want to continue to thank everyone who has been accommodating our returning nationals in the parallel healthcare system. And Minister Cox, that's the report for today. And I again want to welcome our new guest, Mrs. Camille Campbell, counseling psychologist, to deal with issues relating to our children. Thank you very much.
Thank you very much, Minister. At this time, Dr. Hazel Othello, Director Mental Health at the Ministry of Health, will speak on COVID-19 and related stigma. Dr. Othello.
Good morning, Trinidad and Tobago and listening public, wherever you are located at this point in time. This morning, I want to help you to understand a little bit more about the impact of stigma with reference to COVID-19 and how we can all play our part to combat that stigma. Usually when we want to fully understand something, a good place to start is with a dictionary definition. So I looked up the definition of stigma, and what I found in the Oxford Dictionary is that stigma is a mark of disgrace associated with a particular circumstance, quality, or person. The Merriam-Webster Dictionary also defined it as a set of negative and often unfair beliefs that a society or a group of people have about something. For example, that something might be a mental illness, it might be something like poverty, it might be a geographic location where people live. In other words, people have negative feelings about that thing, and the way they treat people associated with that thing is often unfair and negative and unpleasant. These negative beliefs usually lead to discriminatory treatment of the persons concerned, and it can be very unpleasant for those on the receiving end of stigma. With specific reference to COVID-19, stigma has been experienced in 3 main types of circumstances. There's been negative reference to and negative treatment of persons who have been infected with the COVID-19 virus, as well as their families. There have been negative references to and treatment of persons who treat or take care of persons suffering from COVID-19 related illnesses. And in some countries, there have been negative references to and treatment of specific ethnic groups, populations, or nationalities based on their association with the COVID-19 virus. It is important to note that sometimes people who don't belong to any of these groups find themselves on the receiving end of stigma purely because of an association somebody makes between them and one of these groups. In other words, they experience profound loss of their status or of the way they are normally treated because of a perceived rather than real association with some aspect of the virus. And as a result of this, stigmatized persons tend to be labeled, they tend to be stereotyped, they tend to be discriminated against, and they tend to be ostracized. Why is stigma associated with COVID-19? One of the reasons is that it's a new virus, it's a new disease. People don't know much about it. There are so many unknown aspects of the virus. We're learning new things every day. And some of what we're learning is scary, some of it is concerning. So that tends to contribute, fear tends to contribute to stigma. We are often afraid of what we don't know. So we don't know much about the virus. That causes fear. And it's easy to associate that fear with others. So because you associate that fear with certain people, you tend to sometimes, treat those people in an unfortunate manner. And that's what we refer to as stigma. What is the impact of stigma? First, it may drive persons to hide their illness so as to avoid that discrimination. And we don't want people hiding their illness and avoiding testing and avoiding treatment. So that's not a good outcome. It may prevent people from seeking health care in an urgent manner. In other words, you're having mild symptoms that you think might be COVID-related, but because of the way you know that COVID-related people are treated in your environment, you don't acknowledge those symptoms. You don't seek treatment early. And as a result of that, your symptoms may worsen. And by the time you access treatment, it may be very late in the course of the illness, and your outcome may not be as good as if you had sought treatment early. And then it can also discourage persons from adopting healthy lifestyles. In other words, if there's a stigma associated with wearing masks, people don't want to wear masks. If there's a stigma associated with regular hand washing, just a random example, or greeting with a bounce of the elbow. If there's a stigma associated with one of those things, then you don't want to do those things. But those are healthy things. So that we don't want to assign stigma to healthy lifestyle practices that can protect us from the COVID-19 virus. How do we address stigma? Well, the most effective way to address stigma is by communication, by providing adequate information that dispels fear and removes the uncertainty and the doubt and the confusion that tends to lead to stigma. In that regard, the Ministry of Health and the Ministry of Communication have really been working hard to create an environment in which the disease and its impact can be discussed and addressed openly, honestly, and effectively, so as to provide you, the public, with information on various aspects of the disease and to allay your fear. We now need for everyone to join with us in that effort. We need citizens, the media, key influencers from various aspects of society, and the wider communities to each and every one person. We want each and every person to play their part so as to combat stigma. Your role is just as important as ours. In fact, your role may be even more important than ours, because the community where you live and go to school or communicate, get your entertainment, whatever you do, you have an influence on that community. And if you approach this the right way, then you encourage the right attitudes towards COVID-19 and everything associated with it. And then those around you are encouraged to do the same thing. How we communicate about the disease is also important. Words matter. So we're encouraged not to use words that are negative, words that make people feel badly, words that may seem to blame people for their contracting the disease. We're encouraged not to do that. Instead, we're encouraged to learn the facts about the disease and to spread positive messages, to avoid unconfirmed rumors, to avoid exaggerations. In other words, let's be part of spreading the correct message that dispels a stigma. Let each and every one of us do our part to combat stigma, and let us create an environment that is supportive, informed, and that encourages persons affected by the COVID-19 virus, as well as those who make personal sacrifices to take care of them, to be treated with respect and with dignity. Thank you for your attention.
Thank you very much, Dr. Othello. Camille Campbell, counseling psychologist at the Northwest Regional Health Authority, will speak on coping mechanisms for children during COVID-19.
Thank you, Minister Cox. Minister Dial Singh, Minister Cox, Dr. Othello, members of the media, and the wider listening audience. A hearty good morning to all.
Good morning.
Today I am humbled to speak about children and COVID. In such a short space of time, so many changes have taken place, and this can be a lot to process and understand. Children, you may probably be feeling anxious, sad, or uncertain. These feelings are normal. You may be feeling stressed with things that are happening at home, worrying about if anyone in the family may get sick, or uncertain about the future. One way to deal with stress about COVID is to be informed. Parents, ensure that your children continue to get the right information about COVID. Information may change over time as this situation is fluid. There's a lot of fake news out there, and this can create panic and fear. So provide information that is truthful and appropriate for the age and development of your child. For older children who are quite resourceful, you can go and do your own research. Get information from credible sources such as the WHO or the Center for Disease Control, the Ministry of Health, and things like that. Now, with schools being closed in the country, children are facing unprecedented changes. Your classes may now be online. You may be home missing your friends and finding it difficult to study. When we are stressed, it's hard to stay focused. We may get angry easily, we can't sit still, we may have difficulty sleeping, we may feel worried, tend to cry, or have changes in eating. I've heard parents complaining that their children during this time are just eating out the house with everything that is there. How can we deal with this? We can focus on how you feel. Pay attention to what is happening in the moment and try to give full attention to what you are doing. It is important to have structure and organization. So create a sense of normalcy and routine. You can have a timetable. You can try to put some things in place. Parents for younger children, you could let them know what the plans are for the next day or for the week so that they can prepare mentally for what they are looking forward to. It is important to take breaks during assignments. Now, I know this might be really challenging for the older children. When you are taking a break, try not to move from one device to another. So you are on your laptop for a length of time doing assignments and research and things like that. When you are taking your break, don't go to your phone. Don't go to your tablet. What you should do is stretch. We encourage movement. We encourage that you drink a lot of water. Children feel safe, and they are best when they feel safe and connected. So parents, allow the children time to share. I know it is a time where parents are quite busy trying to manage the home and doing a lot of other activities. But I encourage you today to give your children undivided attention. Sometimes we listen to respond. I'm guilty of that at times. But I encourage you to listen, to hear how they feel, to empathize with them. I have found that you can do chores together. So you are in the kitchen cooking, you can give your children that time there where you can be cutting things together and spending that time there together where you are connecting with them. Fathers, while you are washing the car, you can bring them along. Involve them in activities that are happening at home. And during that time, you can share how you deal with your own stress, and they can learn from you how to cope. Now, children may have a lot of questions about returning to school and exams. You can discuss with them any new changes that might be taking place at school, such as the social distancing and the hand washing. These changes are there to protect them. Allow them to share how they feel, because these changes are new. These changes may even seem uncomfortable. But if we practice them from now, so let's say school reopens in September, we can start disciplining ourselves from home to be observant about what is happening in our home, observant about social distancing, and practicing that hand washing from home so that when we go out, it is a normal thing to do. I would also like to speak to parents and to children who are preparing for the upcoming exams, which is SEA, CSEC, and CAPE. Now, I can't imagine what you children and young adults might be going through preparing for these exams in this season. Exams in themselves are very stressful, and to have the added curveball and concerns about COVID can create additional anxiety. Children tend to learn and react in part to what they see from the adults around them. So I want to speak to parents. How you deal with a situation is how your children are looking on. So if you deal with the situation calmly and confidently, you will find that you are giving the best support to your children. For those writing the exams, give it your best shot. Be kind and patient with yourself. You are in a situation that is quite unprecedented. So it is understandable if you feel stressed, overwhelmed, or unmotivated. I know with the SEA children, there's a time that they peak, which is usually just close to the exams, and now they are just doing revision. So that could be really stressful on them. Know that what you have power and control over. Yes, these exams are important, but they don't define your life or who you are. Tough situation tends to bring out character strengths such as grit, determination, and perseverance. One technique that you can use when you are feeling stressed is deep breathing. Now, you could do this anywhere and at any time. Just like in schools, when you have drills that you practice in case of an earthquake or a fire drill, it's the same thing that I'm encouraging you to do today with deep breathing. You can practice from now so that when you find yourself feeling stressed, you can pull from your memory in what you already know. So deep breathing means you're just breathing from your diaphragm. For younger children, parents, we can help them do deep breathing by buying bubbles that they can blow into, or you can lie on your back, both of you, you and the child, put a teddy or some kind of stuffed animal on top of them, and as they breathe in and breathe out, they would see the stuffed animal rising and sinking on their tummies. I want to leave today talking to parents. When you are better prepared, informed, and in tune with how you feel, then you can be more reassuring to those around you. Know that you are worthy enough to practice self-care. Sometimes we feel as though, especially mothers, we are at the bottom of the chain in getting things done for ourselves. In the event of an emergency on a plane, you are required to put on your oxygen mask first before assisting anyone else. So that's what I want to encourage you to do today. Manage your stress by taking care of yourself first. Self-care is not selfish. Find time for yourself. That could be having a cup of coffee or a cup of tea in the morning, where you smell, before everybody awakes, where you smell the aroma of the coffee, you taste the nice warmth, you could feel the breeze. Be present when you are doing something. You can connect with your spirituality, with your God, and you can pray. You can exercise, you can read a book. Do something that makes you happy because you deserve it, and those around you will be better for it. So I thank you for the opportunity today, and I now pass you back over to Minister Cox.
Thank you. Thank you very much for such a, lovely, exciting information pertaining to children, because I know a lot of parents, want to know, what should I be doing with these children at this point in time. Thank you again very much. Members of the media, the floor is now open. Remember to identify yourself and the media house you represent before posing your question. We want to give as many of you an opportunity to pose questions to us, but that means in our limited time, we will have to give each media house a chance to get a maximum of 2 questions in. Once we have completed the pool and time allows, I will come back to you. Let us keep this in mind as we begin taking your questions. Priya Bihari.
Hi, good morning. Priya Bihari, azpnews.com. Minister Dayal Singh, a number of people are asking about when you do private lessons, teachers and they do private lessons for SEA, for CSEC, for CAPE. They want to know if they can do it and what are the precautions they have to take. And also there are a number of organizations like AA and Narcotics Anonymous, for example. So they want to find out if they can still meet in schools, if they can still meet in community centers, for example, because in some instances the court would sanction somebody to go to these meetings. So they want to know what are some guidelines that they can get from you.
Okay, thank you very much, Priya. That is a very topical question. So the Chief Medical Officer and myself had a discussion on this issue, not necessarily about private lessons or AA, but we did have a general discussion about some of the, let's say, gray areas that need to be addressed. So I have asked him to convene a meeting of his intersectorial team, which Cabinet has approved. They are going to meet to come up with recommendations to deal with all of this. And let me give you some examples of the others. So we said no children's sport, but then we are getting requests. What about a 17-year-old child who plays football in the Pro League, right? So there are lots of permutations and combinations that we are looking at now, and we have added to that before this morning private lessons, but now you have raised the issue of AA. So it falls into that whole sort of area that we need to have to drill down on now. So that is being done because we have asked the Chief Medical Officer to convene his team to look at that. But thank you for the question, sir.
Thank you. 98.1.
Stephen Cummings, 98.1 FM. My 2 questions quickly. Minister Dayal Singh, would you support a special COVID-19 education program within the public school system, maybe starting in September as part of a wider approach in treating with the virus? And I also want to ask a question. Minister Dayal Singh, you probably can take this one again. Tobago recently received its test kits. I wanted to know about the training of staff and the line of reporting would they be under the THA Division of Health and Wellness, CARFA, and or the Ministry of Health, as well as the grading procedure in line with protocols for use of, let's say, the PCR machines?
Yeah.
Thank you.
Thank you very much, Mr. Cummings. So to answer your first question, special COVID-19 program in schools, I can't give you an off-the-cuff answer now. That is something that we will have to discuss with the Ministry of Education. And if any such program is to be rolled out and the Ministry of Education sees a need for it, as usual, we are there to support any ministry, any organization that wants our expert advice. On the PCR machine in Tobago, yes, we were in Tobago as we know on Saturday, and I think persons went across from CARFA on Monday or Tuesday to do their validation and panel on the machine. So that is going to be up soon, and it follows the same reporting lines as usual. All the reports have to come to the Office of the Chief Medical Officer. There will be no exceptions as far as that is concerned. So Tobago will follow the same reporting mechanism as CARFA, as the UV Virology Lab, and any other center that we are seeking to set up. Thank you very much.
Thank you. Astronaut Health.
Gwyneth Stewart, Astronaut Health Newspaper. Good morning, everyone.
Morning.
One of the things that will impact stigma is knowing whether or not someone who recovered from the disease, from COVID-19, can infect an asymptomatic person. So is there any research available showing whether it is possible for someone who previously had the disease to be a silent carrier or an asymptomatic carrier?
Okay, so the Chief Medical Officer.
Hold on.
Oh, sorry.
Do you have another question? Is there another question? I see you still speaking.
No.
Okay.
All right, thank you.
Thank you, Gwyneth. So the Chief Medical Officer addressed that same issue here again. I would not like to guess at his answer, but it is something that he has addressed, and he will be back next week. So you could pose that question. It's a very technical question that no one on the panel here right now is able to address for you.
Thank you very much. We move to TV6.
Hi, good morning, everyone. Nicholas Touchman Singh
Morning,
here from
Nicholas.
TV6.
Good morning.
We know there was a statement made by Minister Gatsby Dolly saying that there is no final decision made on Carnival 2021 and that she will proceed with guidance from Ministry of National Security and the Ministry of Health as to what should be done when it comes to that. Could you just give us, the public, idea as to the guidelines or to the things the Ministry of Health will be looking at when it comes to hosting Carnival 2021 next year, if so?
Okay, so this question was posed to me maybe about 2 months ago, and I did say at the time, when we come to that bridge, we will cross it. The answer basically remains the same. If the Ministry of Health is asked to provide any technical information or advice into any festival, we will do so, but we haven't been so engaged at this point in time.
Thank you, Minister. I'd like to take the opportunity to say that there is no final decision has been taken by the government of Trinidad and Tobago with regards to the hosting of Carnival. Actually, the minister today issued a release which deals with the fact that there's a misleading headline on Trinidad Guardian concerning Carnival, but no final decision has been taken. We move on to TTT.
Hi,
TTT?
good morning.
Okay.
Ian Wilson from TTT News. Now that the economy has been reopened, maxis and taxis are now operating at full capacity. We are seeing that they are doing so with passengers not wearing masks. Is the ministry, with the input of the Attorney General, looking to make it law or to mandate the wearing of masks, especially now that the economy has been reopened?
Thank you, Ian. That is a question that the Attorney General myself and the Minister of National Security and the Prime Minister, we have looked at it, and the Prime Minister himself said, and I have said on these press conferences in the past, the legal ramifications of having a law making it illegal not to wear masks is something that the Attorney General has advised against. What we are doing from this forum is using strong moral suasion and to ask people to employ a sense of personal responsibility to wear a mask, especially in areas of close public contact, which you will invariably get in public transport. I recently traveled to Tobago on Saturday, and it was so simple because it was enforced that everybody on the plane had to wear a mask. I went to Westmall a couple weeks ago. Almost everybody had on a mask in Westmall. Every doubles vendor has on a mask. So it can be done. So again, we are appealing to persons and operators of public vehicles to please, for your safety, the safety of your passengers, and the safety for your family when you go home, the wearing of masks is something that is very strongly, very, very strongly recommended. And that's the approach we are using right now. We are not going for the use of the force of law. Thank you, Ian.
Thank you. Guardian Media Limited.
Hi, good morning, everybody. Radhika De Silva, Guardian Media.
Morning.
I just have two questions to Minister. The first is that we had reports from nursing personnel that there are no bed sheets, towels, cutlery, and so on at Ward 6 of the San Fernando General Hospital. Can you say what will be done about this? And my second question, can you say whether students who are due to start school abroad in August will be allowed to fly up to attend in-person classes?
Okay, so the issue of Ward 6, that is a matter that you can raise, and I will raise it with the Chief Executive Officer of Southwest. As you could well imagine, as Minister of Health, the RHAs run the hospitals, and the Minister of Health does not have a running commentary or report on the supply of anything on wards throughout 3,000 beds in the public health sector on a daily basis. If this is true, and it will be raised with the Chief Executive Officer, I am sure that he will get the necessary persons to do what is needed. On the issues of students being allowed to fly out in August, that will be a matter for the Minister of National Security to address, and I will advise and point you in that direction. Thank you.
Thank you. Express.
Good morning, Camille Hunt, Express.
Morning,
Minister Dialsing,
yes.
Health workers are continuing to protest, and I know that you indicated before that $39 million in arrears would be paid to the NCRHA. Are there any further thoughts on compensation or payments for health workers across other RHAs?
So, the president of the TTRNA wrote to me formally yesterday requesting a meeting, and we are meeting next week, Monday at 8 a.m. I would like to conduct those negotiations not in the public, to have a public back and forth. I think my style has always been that you could achieve a lot more in private, constructive negotiations and conversations. So let us wait until Monday when I have that face-to-face meeting on the request of the TTRNA.
Okay, we go back to TTT. You had another question, Ian Wason. We go back to you. Yes.
This is actually a follow-up to the earlier question I had. If moral suasion does not seem to be working and people are still hardened, and would that influence if we would return to some of the measures of the restrictions?
Well, that is something that we have been speaking about at these press conferences repeatedly. And that is why we took such a strategic, phased approach to opening back the economy. Because I think we said very often here, we will take a very strategic approach because we don't want to slingshot back in what we did 2 months ago or 3 months ago. Because I noticed that trend in many countries, and it's something we don't want to do. So again, I am also noting the legislative nightmare and protest that goes on in other countries that have made it law to wear masks. Some countries have a culture that allows them to follow that law. Some countries don't have that culture to follow that type of draconian law. As I said, the Attorney General has advised that it is a legal problem to enforce that type of law in Trinidad and Tobago. So we continue to plead, we continue to ask people to wear masks, and it is working. As I said, Caribbean Airlines, no mask, no service, and everybody complies. Doubles men, and they are my heroes. You see, doubles vendors, they are my heroes in this whole thing. They started from day one when they went back out to work wearing masks. West Mall, they insist you sanitize at the entrances, and every store I went into, you had to sanitize. I mean, I must sanitize my hand, Minister, because about 20 times in an hour in West Mall. But those are the things that we have to do. And again, I plead with people. I plead strong moral suasion. Wearing masks will help us not get more cases, flatten the curve, and save lives. Thank you very much, Ian, again.
Thank you. We go back to Astronaut Health News.
Good morning again, Gwyneth Stewart, Astronaut Health News.
Morning, Gwyneth.
Minister Cox.
Gwyneth, you're laughing.
Were you able to find out about the relief grants concerning COVID-19 social assistance? I saw in the Newsday this morning, they referred to the debit cards and the rental assistance and bank account issues. I don't know if the bank account issues are specifically referring to the salary or income support grants. But I had asked, I don't know if you had a chance to find out when those who didn't receive it, when are they expected to receive?
Okay, well, I am pleased to inform you that the Minister of Health would be on the Minister of Finance will be on the press conference on Saturday, and you will get all your details. So be ready to ask all the questions, and he hopefully will have all the answers for you. Okay. I see ACP News.
Yes, hi, morning again. Minister, can you tell me how many members of cabinet have been tested for COVID-19, and if they were they symptomatic?
Okay, so prior, there are so many problems with that question. One, I honestly don't know. I honestly don't know if anybody was tested. And if anybody was tested, I don't know if they are free on their own to disclose that information. But I certainly, as I said, I don't get the personal information by names. All I get from the CMO are numbers. So many numbers are tested, so many numbers are positive, so many numbers are negative. And I have gone to great lengths on these press conferences to protect the privacy of the ordinary citizen. I rest on my responsibility as a Minister of Health, leading a healthcare system, that the highest ethics, the highest ethical behaviors, if I break it, then I become a danger to the healthcare system. I hope that answers your question, Prior.
Okay, thank you. Before I get back to you, Minister, online, there's some persons want clarification whether the 6 p.m. closing time for most stores still remain, or did it move to 10 with restaurants?
Sure. So let me clarify that. So all retail, all stores, regardless, food, grocery, computer stores, everything, motor car parts, everything, you can go up to 10 p.m. Okay? So I hope that clears up that.
Okay, good.
Excellent.
And there's another, some people want some clarification concerning wedding receptions.
Yes.
well, my understanding is that, you know, if you have a ceremony, you observe the normal religious activity
Correct.
protocols. But reception,
Yeah.
is it 25?
Sure.
We want to be clear.
So the chief medical officer, again,
Yes.
addressed that clearly. I could advise people to revisit that video, but what I remembered him saying is that as far as the churches, mandirs, and mosques are concerned, the places of religion, the number of persons that can go into a mandir, church, or mosque are governed by the overall guidelines we set out.
Yes.
So if the place of religion, based on the guidelines, can hold 50, fine. But then the chief medical officer was at pains to make a distinction between a public place and a private place.
Yes.
So I think he covered it very well, because there are different numbers allowed in a public place versus a private place. But he did say all health measures should be enforced. Social distancing, the hygiene, the washing of hands, and so on. But he's on record as clarifying that. And I could ask him to clarify further.
Yes, because
Yeah, sure.
there are different interpretations.
Yeah.
People are interpreting
So what we will do, remember I said earlier that I have asked him to reconvene his subcommittee.
Yes.
So we'll come out with some more detailed guidelines, because I could see where there may be some misunderstanding.
Okay.
I accept that.
Thank you very much. Guardian Media Limited.
Yes, Minister. Recently, the former director of the Division of Aging at the Ministry, Dr. Jennifer Rouse, made a call for memory clinics to be set up throughout the country, saying that COVID-19 could have accelerated cognitive degenerative diseases like dementia. So I wanted to find out from you if this is something that the ministry will consider doing, and if anything further has been put in place to assist the elderly.
Okay, in previous discussions, we have spoken about the thrust towards decentralization of mental health services that is currently being worked on. And the aging population is one of the subgroups that we know we have to meet the needs of. So the subject of memory clinics has been in discussion. Currently, I think the Southwest RHA has one. There was another one that was up and running and may not currently be running, but efforts will be made to re-establish those that are no longer running and to set up additional such services in appropriate locations over time, so that every aging person who needs that service will be able to access that service. It is part of the decentralization process, which will expand mental health services across the length and breadth of Trinidad and Tobago in a way that allows people to access services closer to where they live, and will take away reliance on the mental hospital style of caring for persons with mental health disorders.
And let me just come in here, because this decentralization of mental health was a policy position that, as Minister of Health, I took to the cabinet last year. And because now, not knowing that there will be something called COVID, but decentralization of mental health is going to be one of the most life-changing policies that any government would have brought to Trinidad and Tobago, and the issue of mental health. So you no longer have to have it centralized in St. Anne's. And Dr. Hazel Othello was appointed as that person to drive that process, and some work has already begun.
Astronaut Health, you have a question?
Yes, thank you for the opportunity again. From a concerned caller, are senior citizens' homes allowed visitors presently?
Okay, so under the guidelines that we set up many months ago, we did several things with the visiting of ill patients. At the public health system, we cut off the 2 visiting periods from 2 2-hour periods to 1 1-hour period, allowing 1 visitor in. It is not that we are unmindful that people need to see their families, but we are in the business of saving lives. And anybody in a healthcare facility, whether public or private, as Dr. Othello can tell you, is already elderly, is already immunocompromised, is already ill, and therefore will be even more susceptible to a bad outcome in catching COVID. So what we advise the association that manages these long-stay homes is that try to not encourage visits from outside, because you could be asymptomatic. Go inside a healthcare facility, visit granny, visit mommy. You would enjoy the love, but you don't know you are symptomatic. You take it inside, and then, you have a problem. We must learn from other countries. In other countries, one of the main sources of fatalities and mortalities and death was not from the general population. It actually came from these long-stay homes. Entire populations of elderly were dying across the world. And if we don't learn from that, we are going to be very reckless. So we know these are hard decisions, but it is in the best interest of our elderly to be in, I'm using the word sterile here loosely, to be in as sterile an environment as humanly possible, as humanly possible. So I hope, Gwyneth, you could support me in that. Thank you very much.
Okay, thank you very much. Well, I see that you all are very satisfied today. No more hands up. So, Minister Dayal Singh, I go to you to give us a closing statement.
Thank you very much. I just have one regret that no questions were posed to Camille Campbell on the issue of children.
They are very comfortable.
Yeah, so I just want to thank Camille. I learned a lot of things this morning when Camille said, try and establish the same routine for your children. And I will tell you this, I was doing a walk in my constituency yesterday, and around 6:30 I visited a home, and the two young girls were in pajamas. So I jokingly told the mother, why you have my children in pajamas at 6:30? She said, Terrence, because they call me Terrence. I have the same schedule for my children in or out of school. And when Camille spoke about that this morning, I said, well, wow, that parent, I didn't know that at the time. And how enlightened. So as we move forward with the SCA coming up on the 20th of August, we really want to urge parents to heed the advice of Ms. Camille Campbell, that your anxiety will feed into your children's anxieties. You have to be calm. You have to set the tone. You have to be supportive, because this is a unique situation for all of us. And I think I will have Camille Campbell come back here, Minister Cox, if that's all right with you, next week. Because I think this is going to be a recurrent theme that we need to explore from now until August 20th. And so I'm making a commitment now that even though there were no questions for her this morning, this issue of our children preparing for exams, not only children, the teenagers for CSEC and CAPE, it is too important to have it as a one-off event. So I look forward to having Ms. Camille Campbell come back and carry this discussion further and further as we get closer and closer to these events. As I close, I want to reiterate the call that I think Prior has made, that masks should be worn at all times when you're out in public, especially in public transport, because you are not 6 feet away. You are shoulder to shoulder in public transport. And the closer you are, the more important the public health hygiene measures become. So thank you very much, ladies and gentlemen of the media, ladies and gentlemen of the public who have been listening. Thank you very much for your cooperation. Thank you very much, Minister Cox.
Thank you very much, Minister. Thank you, Dr. Othello, Camille Campbell, members of the media, to the viewing and listening audience. We've come to the end of today's virtual media conference. And do remember that the Ministry of Health and the Ministry of Communications are your only credible sources of government information on COVID-19. On Monday, in-house dining resumed, and as you begin to venture out, we wanted to share with you some of the guidelines from the Ministry of Health. I wish to remind you that these guidelines apply to all restaurants and bars, and it is the responsibility of the owners of these establishments to communicate them to staff and patrons. The ministry advised that restaurants and bars establish a housekeeping schedule to incorporate routine cleaning and sanitization with regular, frequent, and periodic cleaning of shared areas and items. Owners and those who manage these establishments are asked to ensure that cleaning and sanitization occur before opening and at the close of business. All surfaces, inclusive of high-touch areas and restrooms, should be cleaned frequently throughout opening hours. Where possible, shared objects such as payment terminals, tables, countertops, receipt trays, and condiment holders must be cleaned between each use. You are asked to routinely clean items such as coolers and insulated bags which are used for the delivery of food with non-hazardous chemicals. However, it is imperative that the owners of restaurants and bars ensure the safe and correct use and storage of disinfectants to avoid food contamination and harm. A mask must be worn and hand sanitizer dispensers should be set up in specific areas. An adequate supply of paper towels, tissue, soap, and running water should be provided for use before entry. Ideally, the tap should be easy to open and close, pedal activated or hands-free. And please note that this is not the full suite of guidelines. We are encouraging you to get a copy and become familiar with the measures in place. It is available for download on the Ministry of Health's website, www.health.gov.tt. And we recognize that many of you have questions about the opening times of bars. Please note that we will provide clarification via a new public health regulation to be released soon. I am Donna Cox, Minister of Communications. Thank you for joining us today as the government continues its efforts to keep the curve flat and beat COVID-19. Stay safe. May God bless Trinidad and Tobago.
Even during a